Okay, so I just want to thank everyone for coming out to this event. And before I introduce myself, I would like to introduce Dr. Fisher. Dr. Fisher, would you like to say a few words about yourself?
Thank you. Yes, I'd be happy to say a few words. I'm a pediatric infectious disease doctor, so I'm a pediatrician who did some extra study in pediatric infectious diseases. And currently, I'm working at the Department of Health as a special advisor to the Commissioner of Health. And I also work at Monmouth Medical Center as well. So it's a pleasure for me to be here, and I'm happy to be able to talk to you about COVID vaccines and other things. Thanks.
Okay, so my name is Kalindi, and I am a Rutgers University student majoring in public health. And currently I am interning at Raritan Valley YMCA. So this webinar is part of a project that I will be completing for my current class. So to that end, I would like to ask if all the participants would be able to participate in a satisfaction survey to help me prepare for my project for my class. I will attach the survey link at the end of the session. And I'll present it to Dr. Fisher now.
There's a little lag between the time when you ask and when you can be unmuted. But so again, I'm happy to be here, and we're going to talk about COVID vaccines and specifically COVID vaccines for children. So I always start with this disclaimer whenever I talk about COVID-19 or SARS-CoV-2, the virus that causes this illness. You know, our information continues to evolve and change almost daily. And what you've seen recently is a big change in recommendations. So what you hear me say today may be outdated as soon as I say it, or at least by the end of the day, the end of the week, or certainly by the end of the month. So what you need are trusted sources for up-to-date information. And what I would suggest are these three sources. First of all, the New Jersey Department of Health. On their website, they have really all you want to know. They have a COVID dashboard. They have a COVID area where you can ask questions, get all kinds of information on all things COVID. Also, the Centers for Disease Control and Prevention has a wonderful website. Again, it tells you all you want to know about COVID-19, and it also tells you about lots and lots of other diseases. When we're thinking about children, I always go to the American Academy of Pediatrics. We have a New Jersey chapter of the American Academy of Pediatrics, which is the first website. Then there's the national website. And also there's a wonderful website, the healthychildren.org, which is an American Academy of Pediatrics sponsored website. They run the website, and it's constantly updated, and it really is meant for parents to give them the answers to any questions they might have about their children. So it talks not only about COVID, but about all things pediatrics. Next one. Can we go to the next slide? So this is really the good news slide of the whole talk. So this is as of 2 days ago, the incidence of new cases of COVID-19 in the United States. And what you can see on the top is the United States, and then on the bottom is New Jersey. And I want to point out that on that top graph, the very first line across on the x-axis is 200,000, whereas on the New Jersey one, the first one is 10,000. So the reason that New Jersey looks almost as much as the country is just because it's a different scale. And what you see here is New Jersey's incidence of disease has mirrored the rest of the country. So back here in April, and our first case was actually March 4th of 2020, we had our first peak. And that was really, New Jersey and New York were the major places where COVID was happening. Then we had a very long lull over that first summer, whereas the rest of the country was seeing increased disease. But then in the fall and winter, we had big uptake, increase in the numbers. And this was primarily the Alpha variant. Then things quieted down a bit, and then we got the Delta variant. And the Delta variant was with us in the fall. And then you can see this big uptick that began in December. That was the Omicron variant. And the good news about the Omicron variant is as rapidly as it went up, it's also coming down. And I think you can see that in New Jersey, it's come down even more quickly than it did in the rest of the country. Now, again, when you look at our spike of cases of Omicron, we had as many as 35,000 a day, whereas in the country, it went up to over 1 million, 2.2 million in this one day. And in other days, it either hit 1 million or it was very close. So clearly, a lot of disease in this most recent upsurge, but a rapid decrease. And now what we're seeing, particularly in New Jersey, is rates that are as low as they have been in before or between prior surges. Of course, we don't know what will be next. Let's go to the next slide. So just to talk a little bit about the basics of this. First of all, the disease was named COVID-19 by the World Health Organization. And this illness is anything from no symptoms at all, but you're infected with the virus, to a simple cold-like illness, to infection in your lungs with pneumonia, to involvement of many of your organs. You will be hospitalized. You can have problems with your lungs, your heart, your brain, your kidneys, your GI tract, your liver, your muscles, your joints. So it really can go almost anywhere. And unfortunately, as we know, it often ends up with intensive care being needed and all too frequently with death. So in the United States, we have 961,000 deaths reported. So we're getting close to 1 million. And I'm sure you've all heard that globally, we passed the 6 million mark just earlier this week. Here in New Jersey, we've had 33,000, just about a little over 33,000 deaths. Now, the good news is that disease in children is usually very mild, or the children have no symptoms at all. However, it's not always mild, and we can't always tell which children are going to be the ones who get particularly ill from COVID-19. Clearly, illness is more common in children who have underlying problems, but sometimes children who had no prior illness get in significant disease and end up in intensive care units. So far in the United States, there have been over 1,600 deaths in children, and that makes it one of the most common killers of children. And here in New Jersey, we've had 15 deaths, many of them this year. We also have this very unusual problem in children. It's called the multi-system inflammatory syndrome. And this happens about a month after the child has had infection with the virus. They may have had a very mild case, or they may have had a more significant case, but about a month later, their immune system simply goes berserk, and they have this dramatic inflammatory response. So they end up with lots of fever, aches and pains. They sometimes go into shock. They need to be hospitalized. And in the hospital, they need a lot of supportive care because many of their organs are involved. So their lungs may be involved, their heart may be involved, their bowel may be involved. They may look like they have appendicitis, but they have this MIS-C disease following COVID. The good news is that the vast majority of children recover from this, but it takes a lot, and they've spent time in the intensive care unit, and we don't want that for any of our children. As of March 1st of this year, there were over 7,450 cases reported to the Centers for Disease Control, and 63 of those children died. And as of March 10th, we had 190 cases in New Jersey and 1 death. And the interesting thing about multisystem inflammatory syndrome is it seems to be more common in children of Hispanic or Latinx descent, and also more common in African-American Blacks, and less common in whites and Asians for really very unclear reasons. But that has also been true of COVID-19 in general. Let's go to the next slide. We also have this condition called post-COVID, and some people have called it long COVID or long haul COVID or post-acute COVID. And this is a problem for both children and adults. It happens about a month, or it's defined by you still having symptoms a month after you got the viral infection. So you got COVID-19, you may have gotten better, but then a month later, you have some or all of these symptoms. And I think if you look over these symptoms, you can see that this would be very difficult for a child. So they have trouble breathing, they're tired, they have fatigue, and they get worse with even mild activity. They may have pain in their chest or their stomach, or in their joints or bones. They have headaches. They often have cough. Their heart is beating rapidly, so they have palpitations. They frequently have diarrhea, problems sleeping, fever, dizziness when they stand, a whole variety of rashes, mood changes, smell and taste changes, and menstrual changes. And probably most upsetting is this so-called brain fog. And what brain fog is it's loss of the ability to concentrate. So children who were very engaged in learning can no longer concentrate. Some of them lose their ability to do mathematics, or lose their ability to read, or to read as fluently as they did in the past. They also have difficulty concentrating and difficulty with short-term memory. So this brain fog is very concerning. Now, how often does post-COVID happen? Well, depending on who you read, it happens either only 5% of the time or up to 80% of the time. So clearly the answer is going to be somewhere in between. And most people would say probably about 10 to 15% of children will develop long COVID or long haul COVID. Now that's significant when you think about the fact that literally millions of children have been infected. Children account for about a quarter of the infections from this virus. And if 10% of them have this syndrome, we're talking about literally thousands of children who will be affected. And unfortunately, we don't know how to best care for people who have long COVID. We're still learning about that. We're still studying it. But it would be much better if we could prevent this disease. You go to the next slide, please. So the best, before I get to the best prevention, I do want to say a word about variants. Now, this is the variant surveillance. So this is in New Jersey. What strains of COVID-19 do we have circulating? And you can see that this goes from the first date is the end of December in 2020. And at that time, we had a little mix of this and that. And then the Alpha variant started. It came in January of 2021. And it was the major thing circulating all the way up until about June of 2021. Then we saw that Delta came in. Delta started back here in May and rapidly took over as the major strain circulating in New Jersey. And it circulated all the way through until December of 2021. And then we saw Omicron came on the picture. The first cases of Omicron were very early in December, and then it really took over, and it has been the major strain that's around for actually the last few months. Currently, what we're seeing is not only Omicron, but a variant of Omicron called the BA2 variant, or some people have called it the stealth variant. We're not sure what's going to happen with this variant, but it appears to be even more contagious than the original Omicron variant. So now let's go to the next slide. So how can we protect people? And the best way to protect children and adults is with vaccines. And these vaccines, they're safe, they're effective, and they're free for everyone in New Jersey. It doesn't matter if you're insured or uninsured. It doesn't matter if you're documented or undocumented. You can get this vaccine in New Jersey. All you have to do is be here and go to an area where they're giving out the vaccine. And again, it's free of charge. If anyone tells you that they're going to give you a vaccine and it's going to cost you money, that's a scam. So don't be scammed. All these vaccines are free to everyone in New Jersey. Let's go to the next one. So what vaccines do we have? So this is what we have starting, and I've given it to you by age. So for children that are between 5 and 11 years old, the primary series is with the Pfizer vaccine. The Pfizer vaccine is the only vaccine authorized for use in these young children. And it's given as 2 doses, 3 weeks apart. And it's a lower dose that children get than the children 5 to 11 get than those 12 and older. For children 12 to 17, also Pfizer is the only vaccine that's authorized for use. Again, it's 2 doses, but this time it can be anywhere from 3 to 8 weeks apart. And the reason for that longer interval is that it's now been determined that your uptake, your immune response is a little bit better if you wait 2 months between the first 2 doses. And we also know that the likelihood for a rare condition called myocarditis following the vaccine is less if you space out that second dose. So this is particularly important for males who are between the age of 12 to 39, because we want them to get vaccinated, but we want to minimize their chances of getting that inflammation of the heart or the covering of the heart. For adults, there are 3 choices. There's the Pfizer, there's the Moderna, and there's the J&J or Janssen vaccine. The Pfizer is given as 2 doses, 3 to 8 weeks apart. The Moderna as 2 doses, 4 to 8 weeks apart. And again, that longer separation between the first 2 doses gets you a little bit better response. And it's particularly important for men or boys who are between the ages of 12 and 39. The J&J, the primary series is just 1 dose, but it's not really one and done because we now know everybody needs a booster. We also now know that the Pfizer and the Moderna vaccines work a little bit better than the J&J vaccine. So these are now the preferred vaccines for most cases. Let's go to the next slide. Very recently, the recommendations for compromised people have been changed. So people whose immune system doesn't work as well, they're called immunocompromised, and they may not respond as well to those 2 doses. So they need an extra dose. So the recommendation for people who are compromised, and this would be like someone who's getting cancer chemotherapy, someone who had an organ transplant and is taking medicine to prevent them from rejecting the organ, someone who's been on very high dose steroids to control their asthma or for other diseases, or someone who's on the disease modifying agents, the biologics. So in that case, if you got Pfizer and Moderna, you should get a 3rd dose, which is the same dose as your first 2, at least 1 month after your 2nd dose. Now, it could be later than that, but it has to be at least 1 month later. And then you still need a 4th dose, and that's 3 months after that extra 3rd dose. If you got the J&J vaccine and you're immunocompromised, then you should get a 2nd dose 1 month later, and it should be either Pfizer or Moderna vaccine. And then 2 months after that, you should get a booster dose. And again, Pfizer or Moderna is preferred. Let's go to the next slide. Now let's talk about booster doses for all of us. So booster doses are now recommended for everyone who's 12 years of age and older. For Pfizer, you would get the booster dose 5 months after your 2nd dose. And it turns out to be the same dose as you got for the first 2. For Moderna, you get your booster 5 months later, but it's half the dose that you got for the first 2. Now, why are these recommendations different? Because that's the way the pharmaceutical companies tested the vaccine. So Moderna used a half dose, Pfizer used the full dose for the booster. And in both scenarios, that booster dose works. For the J&J vaccine, you should get a booster dose after 2 months, and it should be the same dose. And for booster doses, you're allowed to mix and match. So if you started with Pfizer, you can get Moderna, or you could get J&J. And if you started with J&J, you should get either Pfizer or Moderna to get that added benefit. And again, the Pfizer and Moderna are preferred in most cases. Let's go to the next slide. So do the boosters actually work? And this is a, actually, we're missing one slide. Is there a slide before this? You just go back one. Yeah. So this is a study of how good the vaccines are. And this was a study among US veterans. And what you can see is 2 weeks after they got that dose, there was a very good response and an 86 to 89% chance that they were not going to get COVID, not get infected with the SARS-CoV-2 virus. But over time, that protection went down. For the Moderna vaccine, over 6 months, that protection dropped to 58%. For Pfizer, it dropped to 43%. And for the Janssen, the J&J, it dropped to 13%. So this is the basis for why we need to get boosters, because we know the protection from the vaccine does drop over time. Now, the next question is, do the boosters work? And if we go to the next slide, this is a study from the United Kingdom that showed you just how good the boosters are. Can you go to the next? There we go. So after the first dose, there was 52% of the people were protected, or there was a 52% protection rate. After the second dose, that went up to 72% protection. But over time, by 6 months later, it had dropped back to the 52%. However, if you gave the booster dose, you boosted them to even better than they were after the second dose. And it went up to 88% protective. So clearly, the boosters are necessary and they work. Let's go to the next slide. So my message really for all of you is protect yourself, protect your families, get that booster dose. Now, the next slide will show us how we're doing in New Jersey with getting people vaccinated. So let's go to the next one. So if we look at the baby boomers, so the people who are now 65 years of age and older, you can see we did very well at getting them the primary series. So 100% of them had at least one dose, and more than 95% were fully vaccinated. They got both the doses. And if we look down in the purple bubbles at the bottom, 71% or almost 72% of them have already gotten a booster. We would like that number to be even higher because we know these people are at the highest risk. So we know that the highest risk for hospitalization and death is being older. So we want to protect all of our seniors, everyone who's over 65. But we also want to protect people under 65. And if we look at the 50 to 64, we're doing pretty well. 99% got one dose, probably about 85% got that second dose, and then 58% of them have gotten a boost. But as we get younger, people are less likely to have completed their vaccine series. So if we go way down to the 5 to 11-year-olds, remember they just became eligible in November, but we've only gotten to 39.6%. We would like that number to be a lot higher. The good news is that most children who got one dose did go ahead and get the second dose, so they have a complete course. They are not yet eligible for booster doses. The 5 to 11, the 12 to 15-year-old children have been eligible since last May, but we've only gotten about 2/3 of them immunized, and only about 25% of the people that age who are eligible for a booster have gotten a booster. So we can do a lot better. We still have a lot of people that we could protect better. Let's go to the next slide. So this is to show you how this disease gets around. And this is a picture of a person sneezing. And I think what you see here is when you sneeze, you send out a whole bunch of these droplets. These are little spit particles. And you send those out even when you're talking. So sometimes you notice that a little spit comes out as you're talking. And if you sneeze or if you sing or if you yell, more spit comes out. And that goes out into the air. And if you're infected, if you have COVID-19, then the virus goes out along with each of those droplets and can spread. Now, the other thing I want you to notice is that most of these droplets are dropping to the ground within 3 to 6 feet. But a few of them may, up here, they may stay a little bit airborne. And that's why we sometimes do see disease in people that are not as close as this direct transmission. But most of the time, it's these droplets that are spreading disease. Now, I think that you can see if this person who sneezed had a mask on, when he sneezed, all those droplets would have gone to the inside of the mask, and they wouldn't have gotten out into the air where they could infect other people. Let's go to the next slide. So these are all the things that you can do to protect yourself besides getting vaccinated. So of course, I'm always going to put getting vaccinated first because that's our best bet. But we also want you to consider wearing the mask. If you have COVID-19, you absolutely should be wearing a mask and should isolate yourself. But if you're not sure, and if you have a risk, or if you just want to protect yourself, this mask will do that. So you wear the mask over your nose and mouth. It's got to be over both the nose and the mouth. It doesn't do any good if it's down here over your chin, and it certainly doesn't do any good if it's on your arm. So wear it properly over your nose and your mouth. And what that will do, if you're infected and don't know it, when you make those droplets, they'll go into the mask and not spread to anyone else. If you're not infected, what that will do is it will filter all of the air that's coming into your nose and into your mouth, and it will filter out any virus that's in the air. And this works not only for COVID-19, it also works for influenza and a variety of other viral infections. So this can really protect you. Stay 6 feet away. Why? Because those droplets are most intense 6 feet from another person. Avoid poorly ventilated spaces and crowds, because in those poorly ventilated spaces, things may stay in the air a little bit longer. And in crowds, you can't stay that 6 feet apart. Test if you have symptoms or if you've been exposed and you're concerned. Get tested so that you know whether you're positive or not. If you're positive, you need to talk to your physician, talk to your doctor, see if you need to do anything else. But for sure, you need to isolate yourself from other people. The isolation guidelines are that you stay away from other people, including the other people in your house, for a minimum of 5 days. If after 5 days you feel better, your fever's gone, then you can come out of isolation, but you need to wear a mask at all times for an additional 5 days. So that's to prevent transmission, the virus going from you to other people. Wash your hands often. This is very good advice, not only for COVID-19, but also for other things that you may pick up. Cover your coughs and sneezes. Now, if you have a mask on, you don't need to do that. But if you've taken your mask off to eat lunch or whatever, make sure that you have a tissue around to cover your mouth if you sneeze. Now, if you don't have a tissue, and many times I don't have a tissue, then you sneeze into your elbow. This is what we teach children in grade school. You sneeze into your elbow so that those droplets go onto your shirt or your arm and not out into the air. Clean and disinfect, particularly surfaces that are touched a lot. So doorknobs, desktops, your computer top. Monitor your health daily. And if you feel sick, please stay home. Follow quarantine guidelines. If you're not immunized and you have a close exposure, you need to quarantine yourself for at least 10 days. so that you don't become infected and spread it to other people. And then when you travel, take precautions. You know, for flying and trains and buses now, you still do need to wear the masks. So use those precautions and use common sense when you're traveling. Just be careful. And if you're taking your children with you, be careful with them as well. Let's go to the next one. So that brings me to the end of my comments for you. And I just want you to help us spread the word that this vaccine is safe, it's effective, it's free, and it's our best chance of protecting ourselves and protecting our communities against this disease. And of course, protecting our children. Thanks. I'm happy to take any questions that there may be. And we can stop sharing the slides, I think. Go ahead, Julia. Can we let her unmute?
Yeah, we've got a couple. Oh, yeah. I'm the prompter. Yeah.
We have a little background noise. Julia, if you can unmute, please go ahead and unmute and ask your questions. Let's check to make sure she can unmute. That was my problem when I first started.
She said in the chat that she can't unmute herself.
Okay. See if you can
Hi,
allow
Dr.
her to
Fisher.
unmute.
Can you hear me now?
Now I can hear you. Absolutely.
you.
Go ahead, Julia.
Awesome. Thank you so much for the presentation, Dr. Fisher. I definitely appreciate that. I wanted to ask, in your experience, what are you finding to be some of the top concerns that you've been hearing specifically for, parents or caregivers, and any kind of specific populations or kind of views that are kind of preventing necessarily, maybe specifically for 5 to 11 and 12 to 17 groups, anything like that?
Sure. So I think, parents are very protective of their children, as they should be. And they really want to be sure that this vaccine is safe and effective. And so concerns about safety are probably one of the biggest things we hear. And the good news now is that we can tell you that, more than 1 million children have received this vaccine and they've received it safely. So I think the safety concerns certainly are out there and are appropriate. But as we have more and more information about the vaccine, we do find that absolutely it's safe. We also have, when people think about whether or not they're going to get a vaccine, the things that they want to be is they want to be confident that the vaccine works, so that it works and that it's safe. They want it to be convenient so that they can get the vaccine relatively easily. And in New Jersey, we have lots and lots of vaccination sites. Hopefully, there is a convenient site close to you. And then they can't be complacent. And I think what we're seeing right now is because the number of new cases have dropped, people are getting complacent. They think, okay, I'm good. It's we're out of this problem. The government's told us we can take our masks off. Everything's great. And I'm not going to have to worry anymore. And what I would say is that complacency is going to interfere with people going and getting vaccinated. So we don't want you to be frightened like crazy, but we also don't want you to be complacent. So take this opportunity, give yourself the best protection there is, and that's the vaccine and the boosters, but continue to do those other things. And for some people, we're going to continue to wear these masks for a while because I'm at higher risk because of my age. So I'm going to continue to mask even after the mask mandate has gone away.
Thanks so much, Dr. Fisher. I appreciate it, especially, hearing about the complacency, that fatigue a lot of people have been talking about. And I think, sometimes people see that there's not so many symptoms that affect our younger ones. So, they're like, why bother and why get it? So I definitely appreciate that. Thanks so much.
Yep. And again, I want to stress that while most children don't get very sick, we can't predict which ones are going to be the ones that get very sick and which ones are going to get the multisystem inflammatory syndrome. So you can't get MIS-C if you didn't get infected with COVID. The best way to prevent that is to get vaccinated. And I'll tell you personally, one of the first patients that I took care of was an otherwise healthy teenage boy that no one would have predicted would get into trouble, and he ended up in the intensive care unit. So we can't protect, so therefore we protect as many people as we can. I think Gina has a question. Hopefully we'll let you be able to unmute.
I think I'm unmuted.
You are.
Yeah, I hear statistics like only 30% of children are vaccinated. And I heard you say to, with Julia's questions, people are uncertain, but what can we do to push people towards that vaccination level and improve these statistics and be prepared if there is another resurgence? Sure.
So certainly for that 5 to 11, you're right. It's only about 40% that have gotten their vaccines. We're a little bit better for the 12 to 15. We're up to about 2/3, and the 16 and 17, we're up to about 80%. But that's not enough. We need more. And I think that the best way to handle this is, first of all, to ask people what they're concerned about. Different people are concerned about different things, and sometimes just by asking, you can counter vaccine misinformation, or you can explain that, no, we're not out of this yet. It really is important that you go ahead and get the booster dose. So I think asking the question as to what they're concerned about is very important so that you can tailor your response. You can tell them, if you know, and if you don't know the answer, it's perfectly fine to say, I don't know that answer, but I can try to get you the information.
Thank you.
You bet.
I just have a question too. So what will living with COVID in New Jersey be like moving forward?
So that's a great question. And if I had my crystal ball, I would be absolutely able to answer it. But what I've noticed during COVID is that my crystal ball got really, really cloudy. And every time I thought I knew what was going to happen next, COVID-19 threw us a curveball. So I don't know what will happen next. I think what everyone's hoping is that instead of this being surges, it will be just a chronic low level, and it will become what we call an endemic disease, meaning it's here all the time, like the flu or like some of the other viruses that we see. I think that may happen, but we've thought that many times in the past. So last June, I thought, well, we're pretty much done with this. And boy, we got creamed in the fall, and certainly over this past holiday season, we got a lot of people with infection and unfortunately a lot more deaths. So I don't know exactly what's going to happen, but I know that the things that we've shown that will protect you, we really feel strongly are very likely to protect you going into the future.
And one more question. So as we know, like people, they recommend us to take the flu vaccine yearly. Is this going to be something about the COVID-19 vaccine to take a booster probably like every 6 months or every year?
So that again is something we can't answer right now, but the good news is it's being studied. So the people who were in the initial vaccine trials get monitored over time to see how long their protection lasts. They're also looking at, if you had natural infection, how long does that protection last? And if you had natural infection and you got to get a booster, how long does that last? So all of those studies are happening right now, and that will be what we need to let us know what we do next. The other thing we need to know is what kind of variants are going to show up in the future. And is the current vaccine going to work against those variants? So we don't know, but I think many people think it is very possible that you will need boosters every year, but I think it's too early to tell.
Karen, you can
Can you hear me?
Yes.
I guess I logged in as a guest. Thank you so much for doing this for us, Dr. Fisher. So, quick question. One of the concerns I always hear people say is that this is a new vaccine. It hasn't been tested. Yet it's probably the best clinical trial out there in the world with all the millions of people that have gotten it. The United States compared to the rest of the world, how are they doing with their vaccinations of the children?
So, the United States was absolutely at the forefront in getting children immunized a little bit sooner and as soon as possible. But they are immunizing in Canada, in the United Kingdom, and in many parts of Europe. They're not quite as far along as we are, but they're starting to get there. And we at the beginning of this pandemic, we didn't think that children got infected at all. We now know that that's not true. And we now know that about a quarter of the new cases are in children. So it definitely is worth trying to protect them so that they won't get sick, and also so that they won't be replicating the virus and having new variants emerge.
And a follow-up, how soon do you think we may get the approval to go 5 and under?
Oh boy, we thought we were going to have it in March, but the new thought is possibly as early as April, but it may take a little bit longer, so it may be May or June. The question is how it's the original dose that they picked turned out to be probably a lower dose than, not probably, is a lower dose than might be needed. So right now they're looking at giving 3 shots instead of the 2 shots to see if that will protect the younger children. And they may also look at a different dose.
Dr. Fisher, I have a question.
Sure.
How do you deal with parents as a physician who are anti-vaccine even before COVID?
So again, I think the most important thing is to ask them what their concerns are. And there are about as many different concerns as there are people. So there are some people who have gotten misinformation, and they think that you can get COVID-19 from that vaccine, or they think that you can get measles from the measles vaccine. So the first thing you do is ask what your concern is. And if that's your concern, then it's very simple to answer that question. No, you can't get COVID-19 from these vaccines. Now, measles is a little different. Measles is an altered virus, and it is a live virus. So you do get a mild infection when you give the measles vaccine, but it's not the wild measles that causes significant fever and trouble, and across the world, significant deaths. So I think the first thing to ask is, what's your concern? Other people are concerned that they are allergic. So they have an allergy to eggs, and they think because of that allergy, it's not safe for them to get certain vaccines. Right now, the egg allergy is not a problem for the vast majority of vaccines. So we've gotten better at making vaccines that don't have any egg products in them, so that people who are allergic can take them. Other people are concerned about side effects, and sometimes you just need to tell them about what the side effects are. Other people are concerned that they have a relative who had a problem, and then you need to see what was that problem and what are the chances that they would have a similar problem. So for me, the most important thing is to understand that people have questions. It's good that they're questioning what they're going to get, and to clarify what their beliefs are, what they've heard, what's correct that they've heard, what's incorrect that they've heard. And if I don't know the answer, I'm happy to say I don't know the answer to that, but I know where I can find it.
Thank you.
Looks like we have another question from someone who signed in as ARSH. If you can unmute, please go ahead and unmute and ask your question. If you're having trouble, you can try putting it into the chat.
should be unmuted.
Yep, it looks like you're unmuted. So go ahead and ask your question if your hand is up.
I can speak it for him. He says, is it necessary to get the booster dose even though you were infected with Omicron variant after your primary vaccinations? Studies have shown that we get profound, robust natural immunity after Omicron infection, BMJ.
Okay, so that's the British Medical Journal. So there are studies that show that you do get good immunity from natural infection, but there are also studies that show that over time that immunity does drop. So what I would say is we would recommend that even after you had disease, that you go ahead and get a boost, get a vaccine as a booster, because it will make your natural immunity even better. So it will boost your natural immunity. Now, I know that there was one study that suggested that people who got the vaccine were not as well protected, but there have been a number of other studies that showed that a vaccine after natural disease boosts your immunity, makes it even better. I don't think you have to rush out to get the booster this minute, but remember, we don't know what variant's going to be next. So I recommend that you go ahead and get boosted when you're eligible.
Dr. Fisher, I have one more question. Do you foresee the regular flu vaccine being combined with boosters in the future?
So we know that Moderna specifically is looking at developing a combined flu COVID-19 vaccine. And I suspect there will be other pharmaceutical companies that will do the same. So it's possible it'll be available. I also suspect that separate vaccines will also be available. And the other thing the pharmaceutical companies are doing is they're looking at the vaccines that they have currently and seeing if they should change them to make them better against certain variants. So you probably have heard that Pfizer and Moderna are making a vaccine specifically for Omicron. That may not be necessary by the time it's ready, but the nice thing is that it is possible to vary the vaccines and make them useful for other variants. I see there is a question in the chat about do we have a definition for religious concerns and how to address those who claim that. Again, I think it's very important to ask the question as to what their concern is. There was a concern by some people that there were fetal cells in the vaccine and that this was against their religion because of the fetus. And in fact, in the current vaccines, the messenger RNA vaccine, there's no use of fetal cells at this point to make those vaccines. So sometimes that's all you need to tell them. We also know that the Catholic Church has endorsed the use of the COVID-19 vaccine. For other people, there's a concern that there's a pork or pork products in the vaccine. And the good news is there's no pork and there's no pork products in the vaccine. So for people who are hesitant to use that, good news, you don't have to worry about that. If you're a vegan, it's okay. There's not, the vaccines are appropriate for use in people who are on special diets, either because of their religion or because they follow it for health reasons. So there's a question about whether BCG, which is a vaccine against tuberculosis, confers some cross-reactivity. And during one of the surges, it seemed that people who had received BCG, so they had that little vaccine mark on their arm, and it's actually the right arm, that they maybe didn't have as severe an infection. That didn't turn out to be the case. In this country, we don't use a whole lot of BCG, so there's not very many people to check it on. But for instance, in India, where BCG is given to just about, to anyone who can get it, there wasn't evidence that it protected them in some way from COVID-19. And there's not a reason there's not an obvious scientific or logical reason why it would protect you. What we know about BCG is it does stimulate the immune system, but people got their BCG years ago. So there's not a biologic reason to think that it would be protective. Although there were a couple studies that suggested it might protect, but not enough that anyone has recommended BCG. And you're very welcome.
Before this session ends, I just want to thank everyone for coming out, and especially Dr. Fisher for taking the time out of your schedule, the East Brunswick staff members, the Y members as well for making this event possible. And before we end, I would just like to ask if everyone could please fill out the survey link that I will be sending over. It would be really helpful for my project that I will be completing. And the survey is anonymous, so you don't have to worry about sending your personal information.